Dr. Jewel Mullen is the former Principal Deputy Assistant Secretary for Health at the U.S. Department of Health and Human Services, where she served under the Obama administration and through the first several months of the Trump administration. In that role, she fostered collaboration among offices within the Office of Assistant Secretary for Health with the goal of advancing public health at the national, state, and local level. She is recognized nationally and internationally as a leader in building effective community-based prevention programs. Please welcome to the stage Dr. Jewel Mullen.
Good morning. I tried not to drink too much coffee this morning because I am so inspired and grateful to be here. I thought if I had too much caffeine, you would have to slow me down, and then you would have to sit me down. So I understand there's a timekeeper. And as everyone else has done, I'd like to just start by thanking Dr. Pranessa Seal for giving me the privilege of coming and being here with you today to talk about a topic that I'm very passionate about. And in my 2 days here, I've had the sense that while many people have talked about the past and shared knowledge, everyone has also given a little bit of a message about what people should do when they go back home. Because this is an action-oriented, future-oriented, transformation-oriented organization that we're all working under the leadership of. So I see it as my responsibility to do the same thing and bring you my own personal call to action, inspired by a lot of what I've also heard over the past few days. And in looking at the title, Why Us? Understanding the Social Determinants of Health, I quickly took myself out of thinking, why us, from the perspective of woe is me, woe is us, why are we so troubled? To flip it and say, why us? Why is it so important that we do this work? And why is it us that need to do so much of the work that I'm going to talk about? And the clicker works. So as I talk about health, I just wanted to orient us to thinking about health as the state of complete physical, mental, and social well-being. Many people, in looking at this World Health Organization definition, have also said, where is spiritual in this? And some have said it's inherently in there, but I want to call that out. And we're talking about health, not just not having diseases. And people have talked a lot already about health disparities and what that means in terms of the differences in health that are actually avoidable differences. Avoidable if the conditions or the determinants that were responsible for them, things that were related to people's ethnicity or their religion or their geography or their sexual orientation or their level of ability, didn't have systems set up to put them at a disadvantage. And ultimately, what I know we're all thinking about is wanting to move to a place of equity, of fairness, of justice, where it's not just that people are equal, but that people have the opportunity to reach their fullest potential, that they're not suffering from disparities. So, because I live in Washington, because I really believe, as somebody who's worked at the community level, done research, and worked in government, many of us spend a lot of time and a lot of careers talking about the same thing generation over generation over generation. Sometimes telling ourselves in nice words and with nice data what deep down we already know, that I thought I would frame this presentation through the perspective that I wanted to bring, having had the privilege to visit the National Museum of African American History and Culture multiple times, by going online at 6:30 in the morning to get same-day passes without having to wait months in advance. So how many people have been there already? So some of you will recognize some of the slides that I'm going to show, because what I've done the past couple of times is just go in with this presentation in mind to think about reinforcing the message that I wanted to bring as we think about writing the next chapter to be a chapter that really is about health equity. So I start with a quote from the Chicago Commission on Race Relations, that the past is of value only as it aids in the understanding of the present, and an understanding of the facts of the problem is the first step towards its solution. And why us? And I understand you might not be able to read the print in the back, but basically, in the messages that even Dr. Henderson, who was here last night, talked about, you'll see so many references to the role of the church in the economic and social and personal well-being of individuals and communities. African Americans developed diverse religious institutions to ensure their survival and their progress. They served as centers of moral and political leadership and provided services and support to urban and rural communities, offering hope and comfort to resist oppression and the values of self-determination and pride. So there's a lot there. And there's a lot there that refers to what churches historically have done to support individuals, to feed people, to clothe people, to provide spiritual support, but also to activate us all against oppression and for fairness. My personal example of why us comes from the blessing of knowing Mrs. Beatrice Flemister, who my sister has written a hashtag now, hashtag Thank God for Life, because that's what she always said. She was born in 1907, at a time when the life expectancy for Black women was 34, and for Black men was 31. And at that point, the life expectancy for Blacks was about 15 years shorter than it was for whites. And she died in 2016 at the age of 109, which was more than 3 times her expected longevity. That's my grandmother. So, everybody who remembers Willard Scott and the Today Show, we kept thinking, oh, she's almost 100. Maybe she'll get her picture on the Smucker's jar. And every year, we would send her name in, and she wouldn't be one of the people chosen. And we kept thinking, well, how long does she have to live? Do they realize how old she is? But finally, at the age of 108. And I can tell you, she was cognitively intact. She didn't care whether or not she was on the Smucker's jar. But when you think about what that really means, as we honor older people all the time. So people asked her, well, Miss Flemister, how did you live so long? And her answer was always, thank God for life. Thank God for life. So when I think about her and what it really meant for her to live that long, I thought, well, maybe there's something about public health and medicine that contributed to it. And certainly, there have been articles written about the great health achievements of the 20th century through which she lived that contributed most likely to her well-being, whether or not that has something to do with vaccinations or car safety or family planning and efforts to improve maternal and child health, or the recognition of tobacco as a health hazard. I would also say that knowing my grandmother, Mrs. Flemister, there were other things going on with her. She graduated from high school, something that wasn't very common. She and my grandfather both worked. She was a Rosie the Riveter type during the war. She had tremendous social support, even into her latest years when she had excellent caregiving. She was self-empowered. She kept her doctors on their toes and made them explain things to her. She would go in with the PDR when they would want to prescribe something and say, wait a minute, tell me about these side effects. And until the end, they called her Mrs. Flemister, which resonated with me, who, as a medical student in 1977, said to myself, why is it that sometimes when the doctors I'm learning from come in to talk to African American patients, they're calling them by their first name? So there was a lot that my grandmother embodied that also reflected social determinants of health. And the fact that she remained cognitively intact for her 109 years, I think also reflects some of how she benefited from some of the public health achievements, because she kept a lot of the chronic diseases that contribute to physical and cognitive decline under control. And all of that is a reminder to us that for all we do to think about healthcare and how it relates to people's well-being, when people have actually broken down what it is that determines the health of a population, they'll say that it's only genes and biology accounting for about 10%, only your medical care or your health care accounting for another 10%, that you have 30% that's related to your health behaviors, and we've talked a lot about diet and physical activity, et cetera, another 40% on the social environment, and 10% on political context. So I put that 10% with the 30 and 40 and say there's 80% of what affects our health that really isn't about anything inside our body or the things that people do to it medically. That's a lot of social context. So going through the museum, you get fantastic reminders, once again, of how people have been making these points for a long time, like Dr. W. Montague Cobb, whose research debunked the myth of racial inferiority and the notion that the conditions of African Americans were rooted in our inherent biology and our genes. And as people have moved away and understand that better now, a lot of focus has been to, let's make sure everybody gets health care. Let's make sure people get more health care. Now, I talked about the 10% of medical care contribution to health. And having worked in Massachusetts when the state implemented health reform, I learned early on that even then, when we would say we're giving people more access to care, as the medical director of a neighborhood health center then, when people would come in, we knew that there were folks who still couldn't get insurance, that even if they had insurance, they didn't necessarily have full access to care. If they could access it, it wasn't really always affordable. And even for what they could afford, it wasn't necessarily comprehensive. And even when it was said to be comprehensive, it wasn't necessarily of the highest quality. And that even when it was thought to meet somebody's performance standards, it didn't necessarily reduce disparities. Equity wasn't guaranteed. And there's just an example of that from another picture from the museum. And Pernessa, I hope people will be able to get the slides. Just a reminder from the Lally Kemp Charity Hospital Clinic from Louisiana that just shows where and when people could get their medical care. When coloreds women could get their OBGYN care, and when whites could. Same thing for surgery, same thing for pediatrics. And I don't know for sure, but I can't necessarily tell you that the care that colored women got on Monday mornings from 8 to 10 for OB was the same as the care that white women got for OBGYN on Wednesday mornings from 8 to 11. So that's why I believe I was asked to come and talk to you today about social determinants of health, because there is so much more than the healthcare piece, that as we continue to do the work of health promotion and support for individuals and communities, that we also have to continue to work on changing the context in which people live, all the contexts that impact their health. So social determinants, the conditions in which people are born, they work, they live. The systems that shape how people live. And that includes economic systems, social norms, the things that it's just always been that way, or as some people might think, always gonna be that way. No. And political systems. And a different graphic of it that I thought might be helpful for you, that moves from individual characteristics all the way out from lifestyle to community context to those social and economic factors, is one that's commonly used, that's here. And I'll say more about it in a little while. And then another reminder on this slide, this is a picture taken during the Depression with, as you see at the top, a happy family driving in their car, the world's highest standard of living, to reinforce for people to be positive even during the Depression, because there's no way like the American way. At the same time that we see people lined up for social support, for food and clothing, with the caption also indicating that even among employed people, the wages of African Americans were much lower than the wages of whites for comparable jobs. So you think about all those impacts, economic impacts, and how they ultimately determine your behaviors, what you can eat, what you can do, how you feel, what you can access to care for yourself. And along with that, a model for you where people have said, so what is this about social determinants of health? And when I was studying this 20 plus years ago, what people would say is, well, how does social status get inside your body? How does race get inside your body? And so here's a graphic that you'll also get that goes from the social and political context and how things such as how society views you by race, by physical ability, et cetera, power, position, also continue to root you in certain social classes that then subject you to unequal attainment of goods or services, and exposures sometimes to more harmful conditions in your environment, and along the way will then impact some of the ways in which you choose to or are able to care for yourself, when the options that you might even want to choose to keep yourself healthy aren't available to you. Like the family that doesn't really want their kids to be suffering from lead toxicity, but they can't live in a place where there's not excess exposure in the environment, for example. And ultimately, what that does to one's health. Social determinants, from the very macro, outside of that model that I showed you, all the way down to what happens to individuals, and then in a group of individuals or a population, how you end up with disparities, and why it's important then to work towards equity. And a lot of people, and I don't know whether or not there are any pediatric providers now, will characterize this as well through what happens through adverse childhood experiences. You're thinking a life course approach. So for children who are exposed to a lot of bullying, trauma, family instability, parents who are alcoholic or drug addicted. Those kinds of experiences ultimately impact their neurologic development in a way that also impacts their social behaviors that can then lead them to adopt less healthy behaviors that are the risk factors for more disease and ultimately early death. So if you hear people talk about ACEs, ACEs as well are very rooted in social determinants. And so for those who say, well, okay, but things are getting better, the next generation's gonna be okay, there are a couple of things. One, we don't wanna write off everybody who's here now. And two, as people start really trying to answer, well, how does this stuff get inside your body? There has been more research on what the biologic impacts are of the social determinants. So in some places, you might hear people talking about epigenetics, where actually the outside of your DNA changes in a way that your genes work differently, and in a way that can have ultimately more susceptibility, put you in more susceptibility to disease. And those changes have the potential to be passed from one generation to the next. Or you might, in some conversations, hear people talk about telomeres. And I say these things not telling you that every health professional knows it either, but you're in the conversation, where the ends of the chromosomes that, as they stay intact, are protections against aging and disease and cell death. Telomere length shortens in association with what's called, you've heard the term toxic stress, many, many social stresses. And those shortenings are also associated with more susceptibility to disease. So social determinants get inside the body. Inside the head, we know, inside the body. So it's been very helpful then to think about what do you do about this? And I'm a doctor. I became a doctor because I want to help people. And I love taking care of patients. I miss taking care of patients. I decided my greatest impact could be to be more on the policy side. I made a joke earlier today, that, as you note, that I'm the former Principal Deputy Assistant Secretary for Health. That means that nobody edited my slides or wrote my talking points for me today. And I have colleagues here from CDC who might have especially, I don't know, they might envy me for that right now, so, because they're experts and do good work regardless. But, you know, years ago, the former director of CDC, Dr. Tom Frieden, characterized what's called the health impact pyramid, encouraging people to think about how to get the most bang for your buck from the interventions that you will employ to improve health. And when in his first papers, he was suggesting where public health works, and that public health's greatest role was right up from the bottom level, changing the context for individuals to make the healthy decision, to make the healthy choice the easy choice, is the way people would say it. And at that point, he suggested that things like the socioeconomic factors, the social determinants, were really they were outside the purview of public health. Well, over the past decade, that perspective has shifted, because it's that context, the policies, the political environment, that impacts well-being for everyone. And he made the point that counseling and education, up at the very top of the pyramid, and clinical interventions have less impact on a population. They're helpful one-on-one, but to change the whole landscape, you're not going to get the same changes for as many people. So I wanted to offer you that, because I believe that the work of the church will always be up and down the pyramid. We heard last night from one of the award winners. One of the things they're doing is immunizations, for example. That's a long-lasting protective intervention in the middle. So this is not a talk to tell you just work at the very bottom, but to also say, don't just stay at the top, because we have to address the social determinants. And the church has done that forever. Religious responses to racial and social challenges. That's working on the social determinants. And this is a reference to the churches in the early 1900s and through the Depression, providing spiritual guidance, inspiration, and practical advice to members, food, shelter, training, education, economic strategies for independence, success, and pride. That's social determinants. Another example. Anybody here from Nashville? Spruce Street Baptist Church, one of Nashville's oldest Baptist churches, providing food, clothing, shelter, community support. Chicago, Quinn Chapel AME Church. Same building since 1891. Behind Provident Hospital's development as a place where Black nurses could be educated. Father Divine. And this painting by Charles White, Move On Up a Little Higher. We've already had one reference to Mahalia Jackson earlier this morning, as a reminder of the role of women in the church as well, lifting people up. And a social determinants framework for the church also means working outside the church. We talk about people working with non-traditional partners, others outside the health sector, and having our communities stay together. So, with that, from Mary Still, faith and works must unite on behalf of the thousands that are now and the thousands that are yet unborn. And one of those partners, I thought this was an important reminder from the 10-point plan from the Black Panthers. And I don't know how many people grew up here thinking that even we as African Americans should be afraid of the Black Panthers. Their 10-point plan, decent education, free health care, full employment. They used decent several times. They didn't say the best. They didn't say or else. It was just decent. Decent wasn't even necessarily equal. So it's important to think about how framing an appeal for justice ought not be put into a context that makes you think you're asking for something other than justice. And then with that, back to the model that I showed before in social determinants, just even thinking about that 10-point plan, as we continue to work in the church on the individuals and diseases, to really continue to occupy the space where we shift the socioeconomic and environmental and political conditions that are going to be what really changes things. So I encourage you to deploy your influence, your expertise, and your power. Sometimes people write that the community should be empowered, that people should be empowered. And I suggest to you that if somebody is telling you they're empowering you, they're trying to remind you they're thinking that you don't have as much as they do. You can play a note, you don't have to. But just take that home with you. And then as you do your work, we were reminded last night, there should be somebody in your local health department who wants to work with you. Get the data from your local and state health departments. The Centers for Disease and Control Prevention over the past year has launched an initiative called 500 Cities that enables people to drill down to community level, so that if you are working in a city, and your church is in a certain neighborhood, work with people to get specifics about the neighborhood where you are. That can be also very informative in helping you figure out the strategies you want to use to address social determinants. And build the strategic partners for collective action. So, an example of social determinants, transportation provides access to so many things. It's one thing to give people rides. It's another thing to work with the town's zoning officials and the Department of Transportation to say, put bus routes here, make parking available here, make these neighborhoods walkable, address the social determinants. And as projects are being planned that you wonder whether or not those are going to be good for the community, sometimes people will look at the economic impacts, ask for something called a health impact assessment to also think about ultimately how the health of individuals and communities will be affected. Hospitals who are non-for-profits, and I probably over time, I'm sorry, I'll hurry up, have to annually report what community benefits they provide. In the past, especially before health reform and the Affordable Care Act, many of them reported uncompensated care, but they have to report more than that now. So your healthcare providers and institutions can support some of the work that is influencing social determinants. Counties, cities, and states are creating community health and state health assessment and improvement plans. Be in part of the groups that are determining what those plans will be. Build civic engagement. Everybody who comes to you for a health fair or a health program is also part of the group that can help be part of the masses to push for social change and make sure people vote, know the issues and vote. And then for all of us who are supported by grants, set an expectation that when people are writing a grant and planning a project, they come to you at the outset and not just when they want you to help them enroll people. Know the source of their funds and think about influence how they can be used, and do what their funders are asking. Ask them how they're addressing social determinants and equity and working upstream. That example of transportation changes as opposed to giving people rides. Carry the week's wisdom with you. We've heard that we have enough to work with already. We need to roll up our sleeves, take messages to those that we influence, fight for what we've heard, operate in God's intended purpose, remember the power of each one, and don't travel the path alone. So it's up to us to write the next chapter. As Dorothy Height said, we have to improve life, not just for those who have the most skills and those who know how to manipulate the system, but also for and with those who often have so much to give but never get the opportunity. Opportunity, that's my equity word. And then as we write the next chapter, what we should be thinking that we're doing is writing the next chapter. Nobody can give you freedom, nobody can give you equality or justice or anything. If you're a man, you just take it. Now, my husband said, oh, do you want to change the quote? It says man, what about women? I said, I'm not going to change Malcolm X's quote. But you get the concept, and once again, it's about justice, which you'll also get a reminder from if you haven't been there yet as you leave what I find the most impactful parts of the museum. Martin Luther King's often quoted words, "We're determined to work and fight until justice runs down like water and righteousness like a mighty stream." And we do that to write the next chapter for the next generation, but actually for all of them. And that's my my grandmother with one of her great-grandchildren just a few months before she died. So do all of this thinking about the full life course, birth to death, and the well-being for all of those who need our work and our service. Thank you very much.